Hello and welcome everyone. My name's Freya Sledding. I'm Interim Chief Allied Health Profession here at Airedale. I'm an occupational therapist by background and I qualified quite a few number of years ago. It's been 26 years that I've been qualified, but hopefully today you'll hear from some younger people and some people that have more recently qualified. I'm here today to introduce you to all the exciting careers that we have in allied health professionals. And I'm here from Airedale, which Airedale is an integrated community trust. So that means it's made up of a hospital, but lots of community services as well. And it spans Airedale, Wharfdale and Craven in West Yorkshire. So why am I here today? Well, today is AHP Day. It's the 14th of October. And we want to promote and celebrate the range of all the different professions and all the different exciting careers that sit under this umbrella. Some of them you might not have heard of, and some of them you might, but hope it sparks an interest and lets you find out more about some of the exciting careers we have. As Airedale's trying to improve the diversity of its workforce and the professionals it's made up of, so that it matches more the communities we serve, we recognise we've got some way to go to improve this, and we've got a bit of a mismatch between our current workforce and what we would like in the future. One of the things that we're trying to promote is diversity and equality and inclusion. So what we want to do is really reach out to all people in our local area to say, you could look at these careers and these careers are open to you. And hopefully we've got some really influential role models that you'll meet today to influence you on your career path. Okay, can I have the next slide, please? So this is the range of AHPs. You might have wondered what an allied health professional is. And it's all these professions that are around the outer edge. Allied health professions are made up of 14 different professionals, and they have a wide range and a vital role to play in determining healthcare. The range of the roles assist people at all different ages, really from a baby right through to the end of life, overcome illness, keep healthy, and live healthy and fulfilling lives. So AHPs are established in a wide range of services, and that might be children's services, learning disabilities, education, elderly services, mental health. And you might be familiar with doctors and nurses in healthcare, but collectively these 14 professions are the third largest group in the NHS. So today we'll try and give you a little bit of a taster of each of the professions. Can I have the next slide, please? This is quite a busy slide, but what it's trying to say is there is a career pathway to becoming an AHP. And it's important to know that there are different routes into the profession. Firstly, there's the traditional route that you might be really familiar with, that you'll do your A-levels, you do your BTEC and go off and do a degree at university, or maybe to do it as a second degree, as a master's level. So those are the traditional pathways that we have in place. But what we're trying to do is open up the other pathways so that we reach out to a great amount of people to access our exciting careers. So we work with really skilled assistants within our service and support workers who work with the registered professions to support the services. And what we're trying to do is develop the skills needed for those support workers to progress through. So we work with local colleges and universities to access qualifications, and then they have the ability to learn on the job and progress their career. What we have got is apprentices at different levels, right from our assistants right through to our advanced practice grades. And what we've got growing is our graduate apprenticeship programme. So this is a different way to become a registered profession. And what it gives you the opportunity is to complete a degree within 3 to 4 years whilst you work within a support worker's role. We have currently 2 professions, occupational therapy and physiotherapy, that are established, and we can access them locally, but we know that this is a growing field. So watch this space, and we are hopeful that all our AHPs can access those ways forwards. I'm now going to hand over to you to some representatives that work at Airedale from all the professions, and hopefully they're going to talk about their journey into the profession and try to inspire you to look at those careers that they've just embarked on. And they might talk a little bit about what's happened during COVID and what the opportunities are. So firstly, I'm going to hand you over to David, who's an occupational therapist.
Hello, so thank you for that. My name's David, as Freya just said, and I think I've been asked to talk today because I'm a man in the occupational therapy profession, which is a bit of a minority really. It tends to attract women generally. So a little bit about me then. I live in Leeds, but I work in Airedale. And obviously you can tell from my accent that I'm from Scotland, a small rural town, and I'd done my undergraduate degree up in Glasgow before moving down to Yorkshire. So how I found out about OT then, one of my parents works in healthcare, she was a nurse, and I was interested in looking into nursing. Then I noticed that nurses were looking quite stressed and busy all the time, and I spoke to a few different nurses, and they said that OT sounded like a really good profession as well, and also saw that it kind of correlated a lot with my sociology degree, in that you sort of have an evidence base behind your practice. You sort of look at every individual case differently and things like that as well. So I saw that correlation, and also there's a master's degree into occupational therapy as well. So that's what kind of attracted me to originally. I'd done my work experience then at the hospital that I worked in. I was a porter, and I actually cleaned the occupational therapy department for about 5 years. But I didn't know what occupational therapy was, didn't ask about it until I started looking into it as a career as well. So that's something I think often hospitals have a physio department and an occupational therapy department, and everybody knows what the physio department is, but nobody really knows what the occupational therapy department is. So it's something to think about. Yeah, so the master's degree seemed like a really good option for me, and moving down to Leeds, relocating. It was a really good experience in general. I'd done it at Leeds Beckett University. It was an extremely intense couple of years, but I had a really good time in Leeds. It's a really good student city, and Leeds Beckett as well is a good sports university as well. I'm not massively into sports, but I'm sure a lot of people will be. So there's lots of opportunities alongside that with the university. So my placements then, it was a really practical course alongside being really academic. And I'd done placements in elderly mental health inpatients. I'd done placements in social services. I'd done placements with a community hub, and I'd done placements in community mental health as well. So you can see from that how various the profession is, that you can work with people with mental health issues, physical issues, a little bit in between, and there's loads of developing roles within occupational therapy as well. And I feel like getting started with the rotation in Airedale is going to set me up for my career really well. So currently I'm on a Band 5 scheme. It's a rotation scheme, which means I change jobs every 6 months within Airedale, and mental health trust as well in Bradford. So I've currently done medical wards and community rehab, and I'm currently working with children in the Child Development Service as well. So that's a really interesting role for occupational therapists. Also a little bit about COVID during the past little while, because it's taken it's had a big impact on all of our jobs. I was in the community teams, and rehab seemed to take a bit of a sidestep during that time, because it was such an acute illness for everybody to kind of think about. So we were seconded into another team to deal with that more directly, which was really kind of rewarding as well. So yeah, that's kind of my experience so far, and I'll pass you over to Misfa, I think, next, one of the physios.
Hi everyone, my name is Misfa. I'm one of the Band 5 physiotherapists at Airedale Hospital. So just a little bit about my journey to physiotherapy. So I went to an all-Muslim girl faith school, and as you do in year 10 and 11 when you have to look into all the careers and what you want to do in life. At that age I was quite nervous because you're quite young and you don't know exactly what to go into. So I started looking up into all different professions, and I never came across physiotherapy or occupational therapy or radiography. Things they just didn't crop up during that time. So I did some digging in on the careers website and came across other areas like psychology, medicine, nursing, just like the norm you would go for in that situation. But they just didn't ring a bell with me. So then I looked up and I kept searching and searching, and I came across physiotherapy. At first I was just a bit like, oh, this sounds really interesting, I'll go and give it a go and see how it is. So I booked myself onto like a 2-week placement at the Yorkshire Clinic, which was an eye-opening experience. The thing with, especially because obviously coming from an all-faith school, we're kind of given the idea that you're just going down the psychology or doctor route, because it's kind of instilled within the culture growing up where, oh, I want my daughter to be a doctor or a nurse or something like that. So physiotherapy wasn't really in that specific area. So going to my placement opened my eyes and allowed me to then look into a whole different world of what there is to expect other than these other normal career paths. So during that experience, it allowed me to look into how the human movement works, the rehab aspect of it all, and it just intrigued and interested me. So I then went away and my heart and eyes was just set on physiotherapy. So going into physiotherapy, I applied through university, and at first going through the whole process of university was I gained a lot of help from the careers advisor. So she helped me through the whole career path, how to get in, obviously making sure that I had enough UCAS points during that time. So going for your interview was, especially having the experience to back you up during your interview process, is very important. So because I had the interview and the experience behind it, allowed me to then go for my interview and be more confident in that area. So unfortunately I didn't make it into physiotherapy the first time, but that had given me more of a drive to keep going. So I then reapplied and gained more experience and got into the course. So the reason why I was really interested in physio was because of the rehab aspect of it. Also seeing how getting the patient back to full independence, or even near to how independent they were, made me more feel like I was achieving something in life and giving someone a better life and to progress that further. So it really made me more aware as to how a different profession can cause that. Yes, doctors and nurses provide the same approach in terms of providing the same care, but we're also involved in a really important area of ensuring that patients can go home safely. So for me, coming into Airedale Hospital, I've done different areas of work. So I've worked in the front line, so I've worked on A&E and also the acute assessment unit, which is where if a patient doesn't go home, they'll come into the acute assessment unit to be then discharged home. That's allowed me to gain a lot of discharge planning skills, and it's also allowed me to make sure that I'm able to get a patient back to normal and get them home. But this has also allowed me to work with other healthcare professions, and it's allowed me to expand my knowledge in these areas. So during COVID, a lot of the impact, physiotherapists have had a big role within COVID, especially with a lot of patients who have had chest issues. Because of this, I've been involved in ICU, so where there's really unwell patients. It's allowed me to expand my area within the career, so I'm able to then look into physiotherapy from a different perspective rather than just where I'm currently at. And that's allowed me to then learn more and gain more understanding and knowledge and skills within that. So with physiotherapy, there's a vast amount of experience that you can gain. So you can be working on the wards, you can be an outpatient physiotherapy. physiotherapists, work with children, we work with adults, work in learning disabilities, mental health. So there's a vast range. My advice would be to, if you are considering this career path, to make sure to gain some experience beforehand, and that will give you an idea as to what to expect from this career. It's a brilliant career, and I hope you all really enjoy looking into this career. Thank you. I'll now pass you on to Nida Zaman.
Hi everyone, so my name's Neda. I'm a paediatric speech and language therapist. So some of you might have already heard about this career, but I'd say speech and language therapy is a really varied career. So you could work with people at any age really, including newborn babies all the way up to the elderly. I'd say we're really fortunate in that we get to choose who we'd like to work with. So some therapists work in acute hospital settings with patients who might have swallowing difficulties or communication difficulties. And some therapists might even work with patients who have voice disorders. So it's really varied. I work with children in the community setting who might have difficulties with their speech, so their speech sounds, or with their language, or they might have a stammer. Most of the children I see are either preschool or primary school age. So I'd carry out assessment, provide therapy, intervention and advice. Sometimes I might work with children individually or in small groups or even in a school setting, and we work closely with parents and families as well. So during COVID-19, lots of therapists have been working at the centre of the pandemic really in critical care units. So a lot of the work that we do is vital, I'd say, to help patients who have difficulty with their swallowing and their eating. So we might also work quite closely with dietitians. Some of these patients might need help getting their voice back after they've had something like a tracheostomy tube in to help them breathe. So how did I get into this career? So when I was in secondary school, speech and language therapy wasn't actually a career I'd heard much about. So I'd say don't worry if you're not sure what you want to do yet. So I actually went to university to study a degree in psychology, and when I was coming to the end of my course, I spoke to a family member who had a stammer, and she talked about how much speech and language therapy had really helped transform her life really, and really helped build her confidence. And I remember thinking that this sounds like a really interesting career. So that actually inspired me to contact my local NHS trust. And I then attended an NHS careers workshop that was led by speech and language therapists. And after that, I just knew it was what I wanted to do. And I always knew I wanted to be in a role where I could help people in the same way. So after that, I knew I wanted to gain some work experience. So I worked in a care home with the elderly. Some of them had communication difficulties post-stroke. And I also gained some work experience with children at local primary school. I then went on to study a degree in speech and language therapy at Leeds Beckett University. And I really enjoyed it. And I really enjoyed my placements as part of that course. There's so much I love about my job. I'd say the best bits are that every day is different. It's really varied. So I could be working with a child who has a stammer, or for therapy for a child with a speech sound disorder. I really love working with children. I think it's so much fun. They make me laugh and smile. There's never really a boring day, I'd say. I get to work with their families, and it's really rewarding to see how much children progress, and to be able to play a part in making a difference to their lives. It really makes it such a fulfilling and enjoyable career. So I hope you found it interesting learning about a career as a speech and language therapist, and good luck in the next steps that you take. I'll just pass on to Riddhi.
My name is Riddhi. I'm one of the dietitian from Airedale Hospital. I work on surgical and ICU wards. I would like to tell you about my journey of becoming a dietitian. So I did my master's in biology in India, and then that time I met dietitians over there, and I thought, oh, this is something really, really interesting, because I was always interested in nutrition and healthy lifestyle. So when I moved to UK and I got an opportunity to study further, and I chose the course to become a dietitian, and I did my course at Leeds Beckett University for 4 years. I really enjoyed my course. It's fascinating journey, clinical and non-clinical placements. And then straight away, once I qualified, I got a job at Airedale. I started as junior band 5 dietitians, and within 12 months, I progressed into my career, become a senior dietitians. I work in community for a couple of years, and then currently I'm working on, as I said, on mainly on ICU and surgical wards. I really want to throw a light that when we think about dietitians, we just think that we only deal with weight management and we help people to lose weight, but it's not like that. We work in various settings and several specialty. So for example, I've been working as within the NHS, but there are many opportunities for people or for dietitians to work in community, in sports, in media, research. There are fantastic opportunity out there once if you are passionate about nutrition and helping people to and make their lives better with your nutrition knowledge. Dietitians during COVID, we still have very, very important roles, especially on ICU critical care. When patients cannot eat and drink, we feed them using the tubes, and that is really important for their recovery. And sometimes what we do, we help patients to provide nutrition straight into their vein. So it's intense, but it's really important for the recovery after the discharge from the hospital. And overall, if you are really interested in nutrition, helping people, and making a career choice, I'm sure that this is a fantastic career to consider. And if you have any questions, you can email us, and I'm more than happy to help with any of your questions and choosing the career path for you. Thank you very much.
Okay, so can we move on to the next slide? Hello, obviously it's Freya again. We did hope that Dean would be here to talk about operating department practitioners. But unfortunately he's been called away because we are in some crisis today, so we need Dean in theatres. So hopefully we'll add to this presentation, but just to give you a bit of an introduction, and there will be more links around ODPs. They're professions that are skilled to care and support during the phases of preoperative care. So when people are in theatres, so that might be involved in their anaesthetic care, their surgical care, their recovery, or when theatres. So they mainly work in theatres, but they are growing in other areas around different critical care departments. So that's what an ODP does, and they work with various ages, really right from 0 to right till the end of life, so that it's quite a fulfilling career. Can I go to the next slide as well, please? And unfortunately Bernadette's not with us today, but I'm going to just introduce radiography. There are 2 types of radiographers. There's diagnostic radiographers and there's therapeutic radiographers, and they together use a range of imagery technology to work out what disease or what condition a person with an illness has. So you might be really familiar with people x-raying bones if you've got a broken bone, but they also work with other technologies such as fluoroscopy. So that's like a real-time image of someone's digestive system. They might be working in CT, which is actually a scan that cross-sections parts of your body to have a look at that, or looking at MRIs, which builds up like a 3D or a 2D map of your body tissue on your organs. Or they might work on ultrasound, which might be looking at the circulation, the heart, or maybe in antenatal care. So they predominantly work in the NHS, and they work in accident and emergency departments. They work in outpatient departments and in theatres with the ODPs, but they can also work in private clinics and hospitals too. So have a look at the radiography career. Can I go on to the next slide? Hopefully you've heard about some of the AHP professions that we employ at Airedale. We don't employ all 14 professions, but locally there are opportunities. So if you live in the Bradford and Airedale or Leeds area, then do look at these. I'm just going to give you a quick taster of them and you can find out more. Probably the first one of the other 8 that's on the list you'll have heard of, paramedics. You see them a lot on the media and a lot around and about. So in this region they're employed predominantly by Yorkshire Ambulance Service, but they are growing in numbers and working out in the communities and in primary care settings with GPs, in mental health teams, at emergency departments, and they're involved in a range of emergency and non-emergency situations. So you'll have seen them in the cars and their ambulances. The next group are 3 professions, which are art, music and drama therapists. And I have put them together, but they are separate professions in their own entity. And what they use is some arts media as a mode of expressions or communications to use emotions. And they work with all different ages of people, right from children right through to the elderly, and work in a variety of settings, in the NHS, in education, in prison service, private practice, hospices, care homes, rehabilitation settings. So they're very small professional groups, but really talented and have a real impact in people's recovery. The next one is podiatry. And people are employed as podiatrists, and they work with predominantly people's legs and feet, and they diagnose and treat abnormalities and offer professional advice on the care of people's legs and feet so that they prevent any foot problems which then lead to walking and mobility problems. So in the NHS you might see people at high risk of amputations, with diabetes. You might help children with walking problems, or you might go into sports injuries. So that's what podiatrists do. Orthoptists are specialists in diagnosing and managing eye conditions, and they again work with the whole range of age groups. Most work within the NHS, but some work in private practice, and we have a number that work within Bradford teaching hospitals, and they do clinics in community centres, in schools, and work in the eye hospital. Orthotics and prosthetics as a group of professions provide ranges of aids and equipment that correct problems of deformities in people's nerves, muscles or bones. So you might have seen people with artificial limbs, people using splints or braces, or maybe special footwear. And they again work with a range of people in different conditions, and they're very skilled in sort of design skills that use a lot of digital imagery now and technology around CAD and design. So if you've got those sorts of skills, that's a profession really to look into. A lot of people work with sort of in sports areas, which is really exciting as well. Osteopath. Now this is a profession that prevents and diagnoses and treats a wide range of health issues. They use manual therapy, exercise and advice. Predominantly they work in private practice, but they work along different age groups, and they are one of the 14 allied health professions. Okay, I'll go on to the next slide. Okay, so this is my summing up slide. I hope today has helped you and opened your eyes to the range of different health professional careers that aren't just doctors and nurses that work in the NHS. I hope that you look at the range of professions and find it inspiring, and that's something that's tipped your interest. I hope that you've seen people that are working in these careers and can relate to them, and that can inspire you, and just really opening up to looking at those careers and finding out more, and the offer of help is there. If I can go on to the next slide. If you've got the next 30 minutes, what I would do is look at the next link on this slide, and it's a wow video which it shows all the 14 careers and show some real life incidents of those careers. It's quite a nice, easy watch for you if you're looking at different careers. It's about 30 minutes and it's got a lovely question and answer session at the end of it. So I really would recommend that link on top of anything you want to do today. What we want to do today is open up the invite and the open door to work with you as individuals who have seen this locally, but our local schools in the Bradford Airedale area. So if you want to build on this presentation and you're interested in more, then please get in touch. The door's open to do some more question and answer sessions and integrate into interactive sessions with your students. So please get in touch. There's contacts on the last slide. The next link is working with us at Airedale, and some of the people today talked about work experience and getting that work experience. Well, working with us has got a lot of career advice on that, but it's also how you apply for work experience. It's also where we say where our vacancies are. So if you want to come and work for Airedale, that's where you'd see what our current vacancies are. The next link, if you've got some virtual reality, a smartphone or a headset that you can use, there's some really nice links to explore some of the careers in a day of a life of. So if you've got that, have a look at that. And the other ones are to do with AHP roles in general, which give you a bit more of the detail of what people have touched on today. Okay, the next slide. So as I say, we want you to keep in touch, and what I've done is put our social media contacts for us at Airedale there, and we have a Twitter, Facebook and YouTube account that we try and stay connected to people with. We'd love to hear from you. Please connect with us, please support us, please get in touch. Please let us know what you thought of today in this presentation and what you think the next step should be. We're really committed to work with our local community and to inspire people to come into those careers and work for us in the future. So happy to do more. All you need to do is ask. I've put my email on there. Please get in touch. And please use the hashtags to interact with us. On behalf of the people that have presented today, I'd just like to say thank you for your time, and get off and look at different careers and see where it takes you. Good luck with your journey. Take care. Bye-bye.